Hello. So today let's talk about something which I've been asked several times about reflection. Uh, is there a template or a format to write a reflection? How to write a reflection? What is reflection? Uh, and if you look at the portfolio pathway criteria, the curriculum, irrespective of which cohort you are submitting the evidence under, HLO1, in HLO1, there is the criteria, the expectation to submit reflective practice. So again, it is a very important key evidence to submit. So you you would have seen various reflective practice models, and there are many sessions also in every trust where they deliver some sessions on reflective practice, and they mention a lot about reflective models. uh, Personally, for me, reflection is about telling a story. It is your story and what you learned from that story. So that story is basically your own experience, and you are expressing that experience, that journey, in a non-verbal way. And reflection is about you expressing that journey. What was the journey about? What was the experience about? What was it that you felt good about this experience, or you felt bad about this experience? What was the takeaway from this experience? And what did you learn from this experience? And this is something we do every day in our day-to-day practice. It's nothing new. Every day is a new day. Every case is different. Every individual is different. Their sensitivities are different. Even though how much of evidence-based medicine you learn or you read, it sometimes it doesn't fit onto every case, and sometimes some cases challenge you, and it can be an emotional journey for you as well, and that is something you have to reflect on. Reflection could be in any aspect, any area, any setting, whether it is reviewing a patient, whether it's about a case, whether it is about you attending a teaching session or attending a conference where you've learned something which has potentially changed your mindset, or has improved your knowledge base, or whether it was doing a psychotherapy case where that experience was maybe very overwhelming or very enlightening, uh, whatever. So you always learn from any experience for that matter. So reflection is kind of you are describing that journey in a non-verbal way, basically. So there isn't any specific format. You can either you want to use any format, a format can give you a structure, or it could be a very free flow writing. So use a word document, put a heading on reflection on maybe your journey as a manager, as a line manager, or your journey as a senior doctor who provided a second opinion, for example. Your journey of doing CBT sessions with a patient, your journey of attending a teaching session on reflection, basically, or or about research. Maybe uh, you your article recently got published, or your manuscript was rejected. Uh, so you are reflecting on that journey, that how was that experience. So basically, when you're doing a reflection, you are putting a heading, you're giving a background of uh, what exactly that incident was about. So you give a brief background, and then you talk about the learning from there. What did you learn from that? And then you talk about that, is there anything you would have done differently, right? And what is your takeaway from this experience? So a background, your learning notes, like, what did you learn from that? Could you have done anything differently, and what was your takeaway? The other way could be that, you are giving a good context to that particular episode. So say there was a case where you felt, or maybe uh, it was a very difficult conversation you had with a patient or family, for example. And again, you felt very upset about it. Uh, and you had a discussion with your supervisor. So you've given a background to that, this is what happened during the conversation. And then you then think about it that, what exactly, was there anything good about it, maybe that, there was something which you did right, and the team felt that way, but was there anything which you could have done differently? And you had a discussion with the supervisor. Is there anything which you potentially learned from that? Is there anything you would like to then uh, develop in terms of, so say for example, uh, maybe you would like to attend a session on psychotropics, or maybe have a discussion with the pharmacist at some point about a particular treatment plan, or maybe simplest way that, you would read upon the Maudsley's prescribing guidelines on depot medication, or clozapine monitoring, or lithium monitoring, something. What was your takeaway from that? So it has to be very simple, easy to understand, and which reflects your journey and what you learned from that journey. What I will do now is I will just share a couple of. One is, which I already told you about, a Word document where there is no typical, bullet points, or any headings or subheadings. It's a free flow, reflection. So these were the bulk of reflections which I did. But because, these reflections are personal, it's difficult to share that. However, I'm going to share some reflections which where I followed the format, and this was something which I did at the start of my portfolio journey, where I was still learning the art of reflection, and learning to be more reflective in my practice. So I used some forms which my seniors were using, and that is something which I followed. So I'll just share those with you. I did this Section 49 training. So there was a session about how to write a Section 49 report. And it was about the learning event, and why I chose this, because I received I was working in the CMHT at that time, and I received a request where whether I could do the Section 49 report, and I did that. And what were the learning notes from that session, and how did this impact my practice? And it was the ILO days. So which ILO did it cover? So very simple, like nothing fancy, just the date, learning event, CPD, if you want to include learning notes, what is it that I learned from this, and then impact on my practice, and then which ILO it covered. That's it. So this is one example. So here is another example. This is if you want to reflect on your case history, or you want to do a reflection on a particular case you've done, and you've discussed that with your supervisor. So this is a template which I've used on occasions. Although sometimes if I have to be a lot more descriptive, I don't tend to use sections. It's a free flow for me. But if anybody needs a template, so that it's more structured for them, then, this is one of the ways where you can potentially reflect on your cases. So a date and a location where this was done, whether it was an inpatient review, community liaison, basic demographics, some chief complaints and all that. Uh, it's ICD-11 now, so you can put ICD-11 diagnosis with the code. And why did you pick this case? So, what was your involvement in this case? Whether it was a face-to-face remote review, whether it was an MDT meeting or a CPA, or you did a report writing, whether it was a tribunal report or anything for that matter, and a brief summary of the case and what you learned from that. Uh, what do you think um, was was positive from this personally and professionally, especially professionally, that what could be the takeaway from this in terms of how well you did, what were the areas where you think you did well, but what are the areas where you feel which needs further development. And you can also do a reflection on your discussion with the supervisor and which workplace-based assessment, if you did, was completed, whether it was an ACE or a case-based discussion or DONKS, whatever. Uh, Again, this was either whether it was with your supervisor or with your line manager. Again, it's up to you whether you want to include this or with your appraiser. Sometimes we discuss cases, during our appraisal as well, whether you did any case-based discussion with your supervisor, you include that in the appraisal as well, and whether this was discussed in the appraisal, that could be included here. Whether you can include your reflection and maybe reflect on the good medical practice. How did it impact the domains of the good GMC good medical practice, and which HLO this potentially covered? So you can potentially use this as a way to structure your reflection, but it could also be a free flow A4 size. Just describe it without any questions. It's a free flow reflection, so that could be another option.